Knock, knock, knock. Good afternoon. My name is Cece, and I'm going to be your nurse today. And I'm here to do a head-to-toe assessment on you and discontinue the IV that you have, okay? Tell me your name.
H2Tx2Recording.
All right. And your date of birth.
05/24/2001.
All right. Do you have any allergies?
No, ma'am.
All right. Do you know where you are?
The hospital.
And what's today's date?
November the 9th.
And what time of day is it?
It is going on 9 o'clock.
All right. Great. All of that matches. I'm going to wash my hands and put some gloves on, okay?
Yes, ma'am.
Wash, wash, wash. Wash, wash, wash. All right. Mr. Griffin, I'm going to check your blood pressure. And I'm going to check your heart rate.
Okay.
And I'm going to check your respiratory rate.
Yes, ma'am.
And I'm going to check your temperature. Okay. I'm going to put this on your finger to check your oxygen level.
Yes, ma'am.
And since you're not on any oxygen, I expect you to have really good results.
Okay.
Okay?
Okay.
I'm going to check your temperature
Yes, ma'am.
here in your ear. All right, perfect. Your temperature is 98.6.
Okay.
Blood pressure is 120/80, which is normal.
Okay.
Your oxygen level is 100% on room air,
Okay.
and your heart rate is 90.
Okay.
Can you do me a favor and look straight ahead? And I'm going to take a look in your eyes. Okay. Your eyes are equal and reactive to light,
Okay.
3 to 4 centimeters, depending on the space of the light away from your face.
Okay.
Do you have any blurred vision? Do you have any problems with this light that I'm shining in your eye?
No, ma'am.
While I have your attention, can you read those numbers on the wall for me?
FDBCR.
Okay, and the bottom line for me?
TSMCK.
All right, perfect. Since I already checked your temperature, I'm going to go ahead and check the rest of your ears, eyes, nose, and mouth, okay?
Yes, ma'am.
All right. Okay, ears look good. Open your mouth. Stick out your tongue. Say ah. All right. Stick out your tongue and put your tongue from side to side. All right, I'm going to look up your nose. All right, your mucous membranes look good in your nose. Also in your eyes, they look really good. Color's really good. You don't look like you're dehydrated at all.
Okay.
I'm going to check your capillary refills.
Okay.
Your oxygen levels were 100. So I expect that your capillary refills are perfect. Less than 3 seconds. Okay? So I'm going to check the pulses in your neck.
Okay.
I'm going to use my hand and I'm going to palpate your carotid and your jugular veins. I'm going to have you raise your head. I don't see any distension at all. Turn your head to the side. Looks good. Bring your head down to your neck and then back up again. Any pain or stiffness in your neck?
No, ma'am.
All right. Can you raise your shoulders for me? And both at the same time. All right, perfect. Can you squeeze my hands? All right, you have really good strength. Can you push my hands? Perfect. I don't see any edema in your upper arms.
Okay.
I'm going to check the pulses in your wrists.
Okay.
All right, they feel really good and strong. I don't feel any abnormalities. I'm going to listen to your breathing since I already assessed your respiratory rate.
Okay.
Take a deep breath for me. Another deep breath. Perfect. Deep breath. Deep breath. All right, I'm going to check the back for you. Deep breath. Deep breath. Deep breath. Deep breath. Any shortness of breath or feelings like you're dizzy from that? I'm going to check 3 more times. Deep breath. Deep breath. Once more, deep breath. All right, your lungs sound clear. They are equal on both sides. I don't hear any abnormalities, no wheezing, no nothing. Are you asthmatic at all? All right, I'm going to listen to your heart. All right, your heart sounds really good in all of the spaces that I listened in. I'm going to check your peripheral pulse and your apical pulse at the same time to make sure that they are beating up at the same time.
Yes, ma'am.
All right, that definitely is almost perfect. Okay. Do you have any chest pains?
No, ma'am.
Do you have any other abnormalities or any other feelings that feel different?
No, ma'am.
So far, everything looks good and you look healthy for an 18-year-old, okay? I'm going to listen to your stomach. Okay. I'm going to have you slide back on the bed and put your feet up. All right, perfect. I'm going to listen to your belly again. All right, I don't hear anything abnormal in your belly. Do you have any nausea or any abnormal feelings in your stomach at all? Any heartburn? All right, perfect. I'm going to press on your stomach lightly, feeling for abnormalities. I don't feel anything that feels abnormal, so I'm going to press a little harder and I'm feeling for masses, okay? Okay, I don't feel anything. I'm going to feel over your belly button and I need you to cough for me. Okay, and I don't feel a hernia at all, okay? All right, while I have you laying down, I'm going to have you push up on my hands. Right, and then pull on my hands. Perfect. I'm going to push on your hands. Perfect. Put your hands down. I'm going to check the pulses in your lower legs here, starting with the ones in your inner thighs. Okay, those feel great. All right, those are just as good as the others. Those feel great as well. I don't see any swelling in your legs. Do you have any tenderness in your calves? All right, good. I'm going to squeeze your toes, checking out the capillary refill of your toes. All right, you got really good circulation to your feet. Your temperature is good here in your feet, legs, and your arms. Okay. Can you press your feet like you're pressing on a gas pedal? Alternate. Okay. Can you press on my hands? All right, perfect. I'm going to have you bend your knees and I'm going to check your any pain there. Do you need any pain there? Any problem extending your leg that way? Perfect. Bring it back in. Looks good. I'm going to have you bring it this way. Any problems there? All right, good. Push up on my. All right, very good, very good. Press up here. All right, and your knees look equal and nothing feels abnormal. All right, everything looks pretty good. I don't see any abnormalities. Friend, can you go ahead and sit up for me?
Yes, ma'am.
All right. So I noticed in your chart that you don't have any medication.
No, ma'am.
Do you take a multivitamin?
No, ma'am.
All right. For a young man your age, I recommend that you take multivitamins. I also recommend that you drink a lot of water.
Okay.
All right. Do you do any sports?
No, ma'am.
Okay. You should think about doing some sports a couple of times a week. Do you exercise at all? Go to the gym with your friends? Anything like that?
No, ma'am.
Okay, you want to probably incorporate some of that into your weekly schedule. Try to go to the gym a couple of days a week, take walks in your neighborhood, ride a bike, roller skate, things that you can do freely because you are an 18-year-old healthy young man with no abnormalities according to this head to toe assessment that I've done for you, okay? All right. I noticed that when I said you need to drink lots of water, you made a funny face. Is there a question that you have?
How much water should I drink every day?
So you should be drinking about 8 to 10 8-ounce glasses, or if you drink bottles of water, if you use the small ones, you want to try 10 of those each day. If you try the bigger ones, then you should go with the 8, okay? And that'll help you to remain hydrated.
Okay.
All right. I'm going to take your IV out since you don't need it anymore.
Okay.
Your hydration levels look really good. Your skin turgor's really good. Everything's looking good, mucous membranes and all, okay?
Okay.
All right. All right, I'm going to go ahead and peel this off. Put your finger there for me. IV's out.
Okay.
I want to take off my gloves.
Okay.
I have one last thing I need to do for you is I need to check your hearing since we already checked your vision. Okay. So I'm going to stand here and I'm going to say some things and I want you to repeat after me.
Okay. B, C, D.
Okay, very good. X, Y, Z.
X, Y, Z.
All right, so everything looks good. Everything checks out. You look like a very healthy 18-year-old boy. If you don't have any more questions, then I've completed my head-to-toe assessment on you, okay?
Okay.
Do you have any questions?
No, ma'am.
All right, thank you so much for participating, okay?
Thank you.